Sciatica is just a symptom. It's not an actual condition. It's kind of like saying, I have a fever. Well, what caused your fever in the first place? So usually it's an infection. Well, with sciatic related pain or sciatica, we have a lot of things that can actually cause that pain that goes down from the back of the butt and goes down the back of the leg. Sometimes it even goes to the under the foot and into the big toe. And so the first thing in treating sciatica is figuring out why you have it. Is it, one of the common conditions I'm about to name, or is it something uncommon, something that you need a lot of help for from on a medical side, or is it just something that you can come see me? With sciatica, there's a lot of common conditions. The number one condition in which people suffer from sciatic symptoms would be a muscle spasm in the back of their hip. A lot of people call it piriformis syndrome, but we have 7 muscles that rotate our hip back there that can all spasm and actually cause tightness and pressure on the sciatic nerve that then runs down the leg and causes those symptoms. So that's the most common one. It's that thing where like maybe you did a ton of squats or kettlebell swings or deadlifts and you feel like you have tightness in the back of your hip and you also have a little bit of numbness, tingling, maybe burning pain that goes down your leg. That's the number one cause. That one's easy, and that's kind of the approach we're gonna go with today. We're gonna go down that path today of someone who has that muscle spasm in their hip, but is causing that pain. Maybe it refers up into your back, maybe it goes down your leg. But then there's other common ones like a herniated disc in your lumbar spine, which are extremely common. Doesn't always result in pain. A ton of people are walking down the street with herniated disc. They don't even know it. They don't experience pain, but sometimes it can actually cause the pain that goes down your leg. And with that, you want to figure out, do you like flexion or do you like extension? And that might take a little bit more of a guided path than what we're going to offer today, but the things we do today are still going to be beneficial for those people. The next one would be sacroiliac joint dysfunction, SIJ as everybody calls it, or SI dysfunction. That's the joint that's at the very base of your spine. It's where your pelvis and your spine meet, especially with people who are pregnant or have had serious falls on their ass. You can have some of this pain, and it can cause pain that mimics sciatica going down your leg, but it's actually caused by some inflammation in the joint. Another one would be a hamstring strain. Hamstring strains, the muscle that goes from your butt to behind your knee, can mimic sciatica. It can also cause pain that goes down below your knee or up even into your back. So it's taking a good medical history can kind of rule that one out. Then we have 2 types of stenosis. We have spinal stenosis, which is the spinal canal where our spinal cord goes down, can tighten up or get choked. And when that happens, it can cause pain down the nervous system, so down into the sciatic nerve down the back of the leg. It can also cause pain in the front of the leg as well. That one often gets ignored. That's your femoral nerve. But the sciatic nerve is the one that's going down the back of the leg, and that's the one we're talking about today. And then you have foraminal stenosis, which the foramen are the holes on the sides of your spine that the spinal nerve roots come out of, and a pinch on one of those, so they move as we flex and extend. But if we get bone spurs in those, it can also send symptoms or sciatica down the leg. And the last major one or common one we can talk about is spondylolisthesis, which if these are your vertebrae from the side, one's going to shift forward. It's not going to go that far. It goes anywhere between 25 and 75 to 90% forward. And that's because that's an area in your body that is more mobile. And so therefore you move a lot from the areas that you can move from. If the rest of your spine is immobile and this is the only one that can move, it's going to start to creep forward and forward and forward over time because the extension that we're trying to get. That one does not like extension. That's going to cause some serious back pain if you go to extend back. Where the others, it's usually flexion will cause some issues with those. Actually, SI joint dysfunction is kind of up in the air, flexion or extension. But then there's uncommon stuff that can cause this too. The big red flag out of all these would be cancers. There are certain cancers, organ cancers and bone cancers, that can send pain down your leg. That, once again, you take a solid subjective as a medical professional and you should be able to rule that out, but you always have that little thing in the back of your mind that says, okay, something's not adding up. And then we go through all the modalities and exercises, and sometimes we say, hey, I think you need to go back to your doctor. But it's super, 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 super rare, but I gotta list it. Another one is actually a herniated disc in your neck. I've seen it a couple times in my 10-year career, not many, but the person had a herniated disc in their neck and it caused pain in their feet. So that's also a possibility. And then we have peripheral neuropathy that's related to diabetes. And lastly, intermittent claudication, which is a vascular condition. Okay, so we have the uncommon stuff, which we kind of just try to rule out as therapists. And then we have the really common ones, which I'd say like 90 to 95% of the time, that's actually what's going on. And today, like I said, we're gonna treat today like it's a piriformis syndrome, or that spasmed muscle in the back of our butt, kind of where our back pocket is. Guys are always sitting on their wallet. They're coming in, they're like, oh, my butt hurts. And you're like, yo, take that like 5-inch thick wallet out of your back pocket and maybe you'll feel better. So we're gonna go over that. As always, if anything we're doing bothers you, if it recreates your symptoms, if it makes them worse, causes something else to hurt, just stop. There's no reason to continue to abuse yourself. We're going through foam rolling and stretching and nerve glides, a little bit of strength or exercise work or motor control work. But for the most part, it's really gentle today because we're trying to get muscles to relax. We're trying to actually get them to be out of spasm and see what that can do for us. Okay, so we're trying to actually, we're gonna mobilize the piriformis or hip rotators. We're gonna then stretch them, because both of those things have the ability to be like, hey man, chill out. And then lastly, we're gonna fatigue it. We're just gonna use it. We're gonna hold an isometric of our hip for a long time, 30 seconds, maybe a little bit more. I'm bad at counting. And see what that can do. Maybe it gets that muscle to relax because we're telling it when to turn on and turn off. And then we're gonna go through some other stuff that might help our hips move a little bit better, which can take some of the strain off of our back, but also take some of the strain off of that hip musculature. So like I said, a foam roller is gonna help with this stuff. If you don't have a foam roller, I'm just gonna give you the option to stretch during those times. We're just gonna need it twice for 2 minutes, or for 1 minute each side twice, so 4 minutes total. You'll be stretching. It's all gonna be good. You'll still feel good after it. But to start, we're gonna be going over sciatic nerve glides. We're just gonna be flossing that nerve that goes from your obturator foramen or your butt all the way down to the tip of your toe. We're gonna be flossing it or gliding it or whatever you wanna call it, neurodynamic movement, whatever. But you're just gonna be laying on your back. You don't need anything. If you want a pillow, grab a pillow. I'm gonna try to set my microphone up here so you can hear me better. All right, so we're on our backs. This looks like a hamstring and calf stretch I've given you guys a couple times. And you're just gonna grab behind your knee. And then you're gonna straighten out your leg as much as you can. Doesn't matter if it's here. Sorry about that. Doesn't matter if it's here or here. Whatever you can do. I'm gonna hold it up here. And I'm gonna point my toes. And I'm gonna pull them back. Now you wanna approach discomfort, but you don't wanna ram headfirst into it, okay? You don't want this to be something that really makes you uncomfortable. So here I feel a pretty good stretch behind my knee. Maybe it's my calf, maybe it's my hamstring, maybe it's my sciatic nerve. But I'm just gonna go up and down 10 times. Like I said, I don't want this to be something that really reproduces my symptoms. If I touch upon them, then maybe I just back off a little bit, point my toe, I pull, and point. Because your sciatic nerve goes from your butt to the tip of your toe, when you pull your foot back like this, you're actually going to be stretching the distal or further portion of that nerve. Sometimes they call it the tibial nerve. And then from here, I've done about 10. I'm going to keep my toes pulled back. And I'm going to bend my knee and my toes remain pulled back. And then I'm going to straighten as much as I can again. And so now we're going to get the stuff that's up here closer to the butt and in the back of the leg. And maybe you just have hamstring tightness and this feels pretty good. And once again, we're just doing 10. And you'll see I'm not going fast. I'm not wincing in pain. We're just gliding that nerve in its pathway. We're just kind of saying, hey, sciatic nerve, we're about to do some stuff. We're about to put some tension into you. We're about to poke you, prod you, and stretch you. You should just get ready for it. Kind of waking things up. That was about 10. And going to the other side. Holding behind your knee. Leg goes straight, and I'm a little tighter on this side. I feel a little bit more tingling in the back of my leg and even in my heel when I do this, and that's okay. What's funny is a lot of times, if you do this with somebody with plantar fasciitis, they say, oh my God, I actually get numbness and tingling in my foot. And maybe it's not plantar fasciitis. Maybe it's their sciatic nerve. And 4 more. 2, 3. Thanks for joining, everybody. I know it's Monday. It's been a long day, right? All right. We're going to bend, and now we're getting that portion up by our butt. Maybe you feel it still in your calf or in your heel, and that's okay. Just nice and gentle. You should not be wincing. Sometimes this is all it takes to get somebody who couldn't touch their toes to then be able to touch their toes. So if that's been an issue, maybe you pop up before we get foam rolling here and try to touch your toes and see what happens. And I'm going to go 3 more. Okay, so some sciatic nerve glides. I'm going to tilt this so you guys can see a little bit better. There we go. All right, so I have a foam roller, but before we get to that, those of you who don't have a foam roller, you're just going to be doing a figure 4 stretch. So you're kind of crossing your ankle over your knee and pulling up. And you're just going to hold that for about a minute or until we finish foam rolling here. Hey guys. All right, so there we go. Okay, so you're going to take your foam roller. Doesn't matter if it's a short one or a long one. And you're just going to place it on the ground. You're actually going to sit on it. So I'm working on my right side. So I'm going to sit my right butt cheek right down on that foam roller. And then I'm going to cross that ankle over my left knee. Now I already feel a little bit of pressure, a little bit of push on those muscles and structures in the back of my hip. Maybe it feels good and this is all you want to do. But I'm going to go up and down, and I'm just going to roll those tissues, and I spent the last hour or so going over all this stuff, so I'm pretty rolled out. And all we're doing by foam rolling is providing novel stimulus, new, different type of input into the muscles and into the ligaments and tendons in that area. And that signal goes up to the brain, and it goes through the spinal cord, and maybe they say, hey, you're trying to be stretched. Maybe we should send a signal back that says relax a little bit. So we're kind of trying to trick those muscles into relaxing. And that's literally all foam rolling does. You can't apply enough pressure to actually structurally change any of the tissue in your muscles or tendons or ligaments with a foam roller. You have to put thousands and thousands and thousands of pounds of pressure for far too long, hours and hours, to make any difference. All right, and those of you who are stretching, I'm going to have you go to the other side. Those who are foam rolling, taking that foam roller or sitting on it on our left side, crossing your left ankle over your knee, just rolling up and down on the back of your butt. Now, if this gives you any of those symptoms down your leg and the back of your hip, maybe you just take the foam roller away, go into one of these figure 4 stretches that the rest of us are about to do, or a pigeon pose, or some other stretch that you enjoy. Got about 30 seconds left. My left side is hurting a little bit more than my right side. That kind of corresponds with when I was doing my glides, I was getting a little bit more tension in my sciatic nerve on the left side. So, I start to paint a clinical picture of myself. I see that I have that tightness today. That might be why, if I were to have those symptoms, maybe it's because there's something going on in my hip. All right, so we foam roll, we've kind of relaxed those tissues. Remember, foam rolling isn't something that should make you scream. It should be something that helps you relax and you can easily breathe through. And now for the rest of us who weren't doing our figure 4 stretch, we're going to do that. And if you were doing your figure 4 stretch, I want you to go back to the leg that you started with and maybe do a pigeon pose. Okay, so if you were already doing this, maybe you're doing it now. And if that feels good, Maybe you want to try something else. Maybe you want to pop down and do your pigeon pose for the back of your hip. Now that I'm here, I'm just going to stay here. The rest of you can go with whichever option you like. When I'm doing a pigeon, I don't want to be here rounded in that flex position in case I do have a disc herniation that is causing these symptoms. Okay? Like I said, most of us probably have them. It's not a big deal unless they're really bothering us, in which case spinal flexion isn't necessarily something you want to spend a ton of time doing, i.e. sitting. So I bring my chest up. I'm in a more neutral spine here. Yeah, I'm just hanging out. I'm sitting into this hip, really getting a good stretch in the back of my hip. And I'm going to switch here in about 15 seconds. And I'm going to do the other side. And then we're going to do a really, really long isometric to fatigue the muscles in the back of your hip. All right, so we're going to the other side. I'm going to do a pigeon. I got my leg out in front of me. It's almost perpendicular to my body. I'm not that flexible, and also my hip isn't shaped in a way that allows me to do that. It's not necessarily the goal. The goal is just to get a stretch back here however you can. If you need a yoga block underneath your butt, or if you want to go do that figure 4 stretch, please be my guest. Now I'm just sitting down into it, right in the back of my hip. And once again, just like the other stuff, we're just going to be here 1 minute, just breathing, keeping it easy. We're not going into a ton of extension in our back because some of those things that I listed before, like I said, they don't like extension. They don't like certain things don't like flexion. So today we're keeping it kind of neutral until the very end. Okay, at the very end, I'm going to introduce a little bit of back extension. But there's also ways where you can go through it with a neutral spine. We've got about 5 seconds left here. Then we're going to pop down onto our side. Doesn't matter which one because you're going to do them both. If you have symptoms only on one side, please feel free to just do this on that one side and then rest, but I'm going to show everybody on both. So we're going to be on our side, laying down, getting ourselves a pillow, or maybe we can use our foam roller as a pillow, whatever you want. If you don't have a foam roller, I'm actually going to put a link into my profile where you can get one like this. It comes with a bunch of other stuff too that we'll eventually probably be using over the weeks. But I'm going to keep my hip vertical towards the ceiling. I have my top leg straight, and I'm going to lift it straight up. And already I should feel my hip work. But from here, I'm going to reach back, and I'm going to tilt my toes down towards the ground. Okay? And so I'm up and back, and I'm turning my toes down towards the ground. Let's see if I can get you guys to see that. So I'm up and I'm turning. There we go. And I'm back and I'm squeezing and I'm squeezing. I'm just holding. I'm not going up and down. I'm just holding and holding and holding. And you are just holding. We are shooting for 30 seconds. If you get fatigued and you're done, give it a little break and then get back up here for the rest of the 30 seconds. I'm shaking like a leaf. I feel it squeezing right up here in my butt cheek. All those hip rotators are working, and we got 2, 1. Okay. So if that was the only leg that you had symptoms on, you're more than welcome to rest, or you can do another rep. I'm off to this side. Hips are vertical up towards the ceiling, leg comes up, leg goes back, toes go down. Maintaining that trunk stability. I don't have flared ribs. I'm still stable in my trunk, providing a nice base of support or a stable platform for my hip to move off of. And we've got, 15 seconds left or so. As normal, I'm terrible at counting, even with a watch. We have 5 seconds left. Okay. All right, so if you got your foam roller, you're going to need it. You're going to want it. If you don't, you're just going to go down into a hip flexor stretch. Toes are down and back, working on toe mobility, tucking your pelvis, coming up, and pushing forward. Now, why do I have you doing this if it's the back of your hip that's bothering you? It's because if you're always fighting against tightness in the front of your hip to produce extension, your glute, or let's say your brain, is going to try to recruit all the muscles in the back of your hip to try to produce extension. And that includes your piriformis and other hip rotators. And so they might be trying to do a job that they're not intended to do, and they get pissed off, and they spasm. And so if we can make hip extension easier, because maybe it's a mobility issue, then just your glute and your glute medius and your hamstrings can do the hip extension, and your hip rotators can just do the rotation, and they don't get angry. So we're actually going to foam roll the front of our hip if we have it. The rest of us are doing a hip flexor stretch. And to do this, we're just going to have our foam roller on the ground, and we're just going to be going up and down on these muscles, kind of where my front pocket is. It's called your TFL, tensor fascia lata, for the long form, and our quads. Both of these hold the potential to limit the amount of extension we can get in our hip. So this guy's going on the ground, and I'm just going right on top of it. And I want to avoid going so far onto my side that I roll over a bone on the side of my hip. And I'm just going to go up and down for about a minute. And just like the back of your hip, it should be something you want to do again. It should be comfortable. If you find a little spot that's a little uncomfortable, maybe you spend a little extra time there, kind of wiggle back and forth, maybe go side to side. You don't just have to go up and down with the foam roller. You can pin and go side to side, kind of scrub the muscle a little bit, give it a different input than just that linear input of stretching and using it. Got about 20 seconds left. Maybe you want to go up and down in your quad a little bit more. It's all good. It's all good. Foam rolling has a lot of room for interpretation. We're going to go and do the other side, and then we're all going to be doing a hip flexor stretch. So if you were stretching, switch sides, and we'll come back and do another one for you. But for the rest of us, we're just foam rolling. If you need to take more pressure off with your opposite foot, be my guest. Let's see, what's going to give you a better show here? There we go. Okay. All right, up and down. Any foam roller is a good foam roller. It can be hard, nubbed. It can be PVC pipe. It can be one of those really soft white ones. They're all good. We've got about 20 more seconds. All right. 10 seconds. And then we're popping down into a stretch. All right, so if you're stretching, go back to the original side. If not, if you were foam rolling, grab a cushion or mat. Put your knee down on. Just like always. Big toe. Tuck your hips. Push them forward as you come up. Trying to open up that muscle now that we relaxed a little bit. And I'm squeezing with my back butt cheek. And if you need to, if you're not getting much of a stretch here, go ahead and reach back. But we want to avoid arching our spines back to cause compression in our lumbar spine. We just want our hips to go forward. So I'll go here. But you don't have to. You can have your foot down, working on your big toe mobility, working on opening up your hip. Working on getting or making hip extension easier so those muscles in the back of your hip don't have to work as hard. We're just kind of distributing the forces. We're taking away the amount of effort those guys have to create, the amount of compensations we have to perform. We've been sitting on those muscles all day. Maybe our glutes aren't very strong, and we go to do a bunch of glute work. We get fatigued, and then the body says, what else do I have in my repertoire that can cause hip extension? And sometimes the rotators can cause a little bit of that extension, and then get spasm, and they get irritated because you're asking them to do a job they just don't want to do. And then we're going to switch. If you need to hold on to something for balance, not a problem. This is not a balance exercise. We're just trying to get as good of a stretch in the front of your hip as possible. Remember, if you're just staying down here, tuck your pelvis and then come up. It's going to allow you to get a better stretch in that front hip. So we're just hanging out, and after this, we're going to do some split squats to kind of use this range of motion, try to solidify the gains in mobility that we've just come up with. It stretches the back of our hip, it stretches the front of our hip, and overall just re-educates our nervous system and our musculoskeletal system, what hip extension is, what hip flexion should be, and what maintaining an upright torso looks like. So we've got 10 seconds left. Guess I should hold on while I'm trying to look at the camera. Then we have just a held position. We literally just do nothing and breathe. We then do a plank, and then a little series of three movements pieced together. So this is going away. Once again, split squats aren't a balance exercise. They are good for balance if you don't want to hold on to anything, but we're going to actually step back. Nice long step with your back toes being your support and your front leg having a vertical shin. And as you go down with your back knee, you should have about 90-degree bend in your front knee and your back knee. And then you're up and down, up and down. I'm always squeezing this butt cheek actually, even on the way up and down, to try to get more hip extension. We're doing 3 more for 8. 1, 2, 3. And look at that magic. Didn't even have to move my feet and I'm in the right position. So we're going for 8. Okay, I had to move it a little bit. Squeezing that butt cheek. 2. And how wide are my feet? Head on. I'm on railroad tracks. Okay? So I'm not way out here. If I'm out here, I'd rather you hold on and keep your position here. 4, 5, 3 more. Then have to be really, really wide. And that's going to mess up or kind of put undue stresses on your knees and hips that we don't want. 6, 7, 1 more, and 8. Okay, so all we're going to do now is something called crawling position. This is a developmental position. Babies go through it when they're starting to creep and crawl on the ground. Some people call it army crawling, but what it can do is it can take some of the tension out of your sciatic nerve if it is somewhere down the line having some pressure put on it. Maybe it's a herniated disc, a tight muscle, who knows. But this position is on your belly with your knee out to the side. Some stomach sleepers out there will find that this is the position they sleep in. I know when I used to be a stomach sleeper, this is how I was. It'd be kind of like a figure 4 position. Try not to kick everything over right back here. So you're basically laying on your belly, and you're going to bring your knee out to the side. And you're literally just laying here breathing. I want you to focus on breathing in through your nose, breathing out of your mouth. And if your symptoms were on the right, all you would want to do is do this position on this side and see where it gets you. Maybe you don't feel any change, but maybe it's a comfortable position for you. We're just going to be here 30 seconds. Then we're going to do the other side. Then we're going to do a plank for 20 seconds on each side. And then do those 3 positions. And then we're all done. All right. And then we're going to change sides. Got my knee out to the side. We're just hanging out. Maybe if this is bothering you, maybe some pillows underneath your hips might be good. Maybe you just want to actually avoid laying on your stomach. Or maybe it feels really good and you want to try something like going into a little bit more extension with your knee bend. Maybe this provides you with the relief you're looking for. We're going to go about another 5 seconds. We're going to switch back to the original side. And so here we're going to be doing a plank. And our points of contact are going to be, for me, it's going to be my right foot, inside foot, the right inside of my knee, my left leg, or my left knee in both hands. So I'm down here, I'm in that crawling position, I'm a little up, because I'm going to lift my hips. And this is all I'm doing. And I'm going to be here for 20 seconds. It's going to use your obliques a little bit more than your abdominals. It's going to use your hip flexors, but you're maintaining a nice neutral spine. You're not going into extension and you're not dumping into flexion. Then we're going to switch in 2 seconds. So then I have this leg back and down, go back out, and I'm up here. Just working on a little bit of trunk stability. Trunk stability plays a huge part in almost all of those sciatica causing conditions that I mentioned at the beginning of this. But a lot of times before we're able to actually start addressing trunk stability, we have to calm the nervous system down. We have to kind of go with symptom management, and then we can do a little bit of trunk stability, and then we can, do a little bit of symptom management the next time, and a little bit more trunk stability, and then we do hip strengthening and trunk stability, and we gradually work our way back from symptom management as they progressively come back up into the leg and eventually into the back, and then they go away. Something we call centralization. And then we can work more towards strength training, core stability, power work, strength work, all these things. I'm just going to adjust this a little bit, sorry. We can do all these things that are more athletic and can help prevent those sciatic symptoms from coming back. And so just because we might have structural changes in our spine or in our hip that might cause sciatic symptoms every once in a while doesn't mean that we have to just suffer with them all the time. People with herniated discs get better all the time. Research points out that usually even without physical therapy or rehab or chiropractic care, most people who are suffering from a herniated disc will be back to their pre-symptomatic condition within 6 months, okay? Doing nothing. No exercise, no stretching, no whatever it is, no modalities, no surgery. But those who get taken care of, or those who work on the way they move and feel, typically feel better faster, and they have fewer reoccurrences of those issues. And so this last thing that we're going to do is just progressing through a mini cobra to a quadruped position, so hands and knees, and then introducing some hip extension to it all. And so for those of you whose back pain might be related to flexion, maybe you don't like bending over, maybe that elicits your symptoms, you're going to like this. For those of you who don't like going backwards into extension, I'm going to suggest just keeping a neutral spine while you do this. The rest of you, you're going to want to actually go into extension. And so we're going in a cobra position, to hands and knees, to hip extension. And we're going to make 5 of these, and then we're done. So you're going to start here, where you're going to make a cobra. So your hands are underneath your shoulders. From here, I'm going to push, and I'm going to do about a half cobra. So I load my spine up into extension. And from this position, I'm going to scoot forward a little bit. And from this position, I'm going to hinge my hips and get up onto my knees. And you'll see that I did not lose that position in my low back. So if I go back down to my chest, or if I go back down onto my hips, I'm still elevated off the floor with my chest. So this is cobra to quadruped. And this might be where you stop. You might like doing these. So we're at 2, 3, 4, and 5. Now we're going to add a little piece to that, and it's hip extension. Hip extension. So we're going to go and do 5 more from the bottom to the top, and then we're all done. So you're going to come down, all the way down. Little cobra, quadruped, hip extension, down. There's 1. Hip extension, 2. Cobra, quadruped, hip extension, and there's 3. Cobra, quadruped, extension, 4. We got 1 more. Cobra, quadruped, extension, down. All right, so as we learned, sciatica or sciatic-related symptoms aren't always related to the same thing. There's disc herniations and spondylolisthesis and piriformis syndrome and all these other things that can cause these symptoms. Really quick, let's see. Mara, if you are in second and third trimester, I don't know about being comfortable on your belly. You can definitely do the quadruped to hip extension, but I wouldn't lay down on my stomach if I were you. Okay, so there's lots of things that can cause sciatic pain. The most important piece of all this is understanding why you're having those symptoms, and then you can do more specific things about it. Today we went through all this stuff, managing as if we were just having a muscle spasm in the back of our hip. It's the most common reason that most of us have sciatic symptoms. But there are those other common things, particularly disc herniations, that can easily be managed with certain exercise routines. I would definitely suggest reaching out to a local medical professional, physical therapist, chiropractor, doctor. If they're worth their salt, they're going to be able to show you things to do to self-manage your care. I would be more than happy to help you. Find me at my email address, kineticpotentialpt@gmail.com, or hit me in my DMs. I'm going to start scrolling through, see if I can see any questions here. Let's see here, a bunch of people joining. Let's see. Yeah, okay. I think it was just that second and third trimester question. Let's see, are these movements helpful in preventing flares of pain? They definitely can be if they're good at preventing. Your main goal is going to be trunk stability and hip extension, regardless of the condition that I stated earlier. I keep pointing up on the wall because I wrote them down. So all of these things are going to be good for prevention as well. But your main goal there is just remaining flexible and mobile and get really, really, really strong. There's a saying out there, you can't go wrong with getting strong. You're not going to lose your flexibility. You're not going to compromise your mobility as long as you continue to stretch and strengthen at the same time. These things are all safe for people who are pregnant, except for that last one. I would avoid laying on your stomach if you're uncomfortable. So later, second trimester, third trimester, they're definitely not going to be positions that you're going to want to be in on your belly. Let's see, let me look at other things. Foam rolling is perfectly safe. Hip flexor stretches are perfectly safe. Let's see, looking at the other things, the crawling positions, obviously laying on your belly, not going to quite be comfortable. If you can adjust to be in standing, in making hip and back extensions, those might be helpful too. Always feel free, reach out. Maybe I can answer your questions a little bit more specifically one-on-one. Yeah, so there are many reasons why you might be having sciatic pain, and therefore there's many different, virtual clinics that I could do on this. In the future, I'll probably tackle the herniated disc one next, and we'll go from there. It's going to be a lot of the same here, a lot of the same stuff. So, like I said, reach out, share with your friends, share with your family. I'm going to be posting this to YouTube. Be sure to subscribe so you don't miss any of the additional videos and things that I'm posting up there. Yeah, and I would appreciate the shares and the mentions and all that stuff. I love being able to help you guys. And if you have any questions, if you have any topics you want me to address, please don't hesitate to reach out. I'm glad that you can do those modifications at 35 weeks. My wife is a little bit behind you. These are definitely stressful times to be pregnant, that's for sure. So I wish you guys good health in that. And yeah, so I will see you guys on Wednesday. We're going to be talking about shoulder stability. But as always, it's going to involve a lot more than the shoulder and the neck. It's going to be thoracic spine and elbow and yeah, a bunch of good stuff. So shin splints, oh boy, I'll definitely be getting there. We'll be covering foot and ankle stuff along the way here. So I wish all of you the best for the rest of your Monday, and I will see you guys on Wednesday for shoulder and neck. Wish you all good health, and remember, reach out to your loved ones and eat well and sleep well. All right, talk to you later.